Welcome back to East Texas Live on KTK. Well, joining us in the living room now is Joseph Zonzik from Christus Trinity Mother Francis.
And today he's going to tell us about COPD in the summertime. Good morning.
Morning.
My first question, what is COPD?
COPD is if you look at it, it's separated to two separate disease entities. The first is a chronic bronchitis where you have a productive cough on a daily basis, usually somewhere between 1 or 2 tablespoons of phlegm per day. And the other is what we call emphysema, and that is where the actual lung units, if you look at a lung and consider that a bunch of grapes, from repeated damage and insult to the lung, those grapes coalesce and form one big unit, and they sort of become non-functional. So it looks like you have a hole in your lung, and there's actually no exchange of your bad air and good air in and out.
So what causes this then?
Most common cause right now is still tobacco use, with your cigarettes, pipe, and cigars. Mm-hmm. Next is industrial, where you have exposures. A couple common ones are hairdressers have been labeled for this. It's kind of interesting.
Yeah, I was going to say I would not expect that.
Then the last would be there's a hereditary form called alpha-1 antitrypsin.
Mm-hmm. And so how do you approach this? How do you live with it?
First, you got to make the diagnosis. So somebody who has significant smoking history, occupational exposure, when they see their physicians, they could ask to have a pulmonary function test done, and that test will show if there's any decline in a person's lung function.
Mm-hmm. So are there ways to prevent this then? Are there things we can be doing on a daily basis?
To prevent COPD?
Yeah.
Don't smoke.
Yeah.
get a good occupation. A good occupation in the hereditary, you're out of luck.
Well, and we were talking during the break, is this a year-long issue then, or is this?
Yes.
Okay.
There's no, what we call peak season is usually during the flu season. Mm-hmm. But usually in the summer, you're faced, instead of cold weather and flu, in the summer you have the hot, muggy weather. People, even though they know they have COPD, they still feel that they could go out in the heat of day and cut the grass and mow the lawns and plant, and then they're in the emergency room.
Yeah, probably not a good idea.
So what are the symptoms, and if you feel these symptoms, what should you do?
Well, usually the people with COPD are on multiple inhalers, and there's what we call the gold standard. There's 4 classifications of the disease. And they also classify it as red, yellow, and green. Green means you're at your baseline. Yellow, you're kind of teetering back and forth. And red, you're having problems. And your physician will outline that, green, you just stay on your inhalers and do what you're supposed to do. Yellow, you might increase what we call your rescue inhaler. And in red, they'll actually outline what we call a rescue package. And it'll describe on how you're supposed to take your inhalers during that time, your rescue inhalers, and it will also add oral corticosteroids to it.
Okay, thank you so much, Joseph. Appreciate it.
You're welcome.
Thank you very much.
Okay, well.